Hi, my name is Shynee Narang. I'm an international yoga teacher and wellness expert. And join us for World Glaucoma Week from March 9th to 15th as our experts share vital insights and do's and don'ts on how to manage this sight-threatening disease called glaucoma. So, doctor, one of my relatives recently got diagnosed with glaucoma. Is it something related to blood sugar or something else?
Glaucoma is a progressive optic neuropathy. In other words, it's a disease which affects the nerve of the eye, the optic nerve of the eye. Glaucoma is usually related to increase in the eye pressure, and sometimes few glaucomas are not related to eye pressure. They may have a normal range of eye pressure also. So glaucoma is an optic neuropathy and a progressive optic neuropathy which affects the eye.
So, why does glaucoma happen to a person? And can it happen to anybody?
Glaucoma affects generally the older population. So anybody who is 40 years of age and older, somebody who has high minus power, high myopia, people with diabetes, people who had previous injuries to the eye, people who have been using steroids for any reason for medical problems. These are all the people whom you must definitely screen and check for glaucoma.
Doctor, how will I understand if I'm suffering from glaucoma?
Unfortunately, glaucoma is supposed to be a silent thief of sight. So what that means is that in the early stages, even in the middle moderate stages of glaucoma, there are no symptoms at all. Patients do not know that they have glaucoma, and only in the last stages or in the advanced stages of glaucoma they start losing vision. So most often glaucoma is without symptoms. And certain patients may have mild symptoms like headache and eye pain, frequent change of glasses. Very rarely an acute type of glaucoma can have headache, halos, vomiting and so on. But that is the exception. The common, most often representing glaucoma is usually without any symptoms.
Doctor, if someone is suffering from glaucoma, what type of medicines would you suggest?
So that is a difficult question to answer in one sentence. Glaucoma is there are so many types of glaucomas. Suppose somebody is diagnosed to have a primary glaucoma and we have something called an angle closure glaucoma. We start off with a laser treatment first. But somebody has an open angle type of glaucoma and it is a milder kind of glaucoma. The general treatment is medication. We start with eye drops. Somebody has a more moderate to advanced glaucoma, we offer laser treatment called laser trabecoplasty. For people with cataracted glaucoma, we offer something called cataract with minimally invasive glaucoma surgery. And for people with advanced glaucomas, we offer surgery. So depending on the stage of the disease, depending on the presence of cataract and glaucoma, the treatment will change.
So doctor, for how long one has to take the eye drops?
Glaucoma is a lifelong disease. Once somebody is diagnosed to have glaucoma and a complete checkup is done, all the tests are established to know that the patient has a glaucoma. And once the treatment is started, the treatment and checkup is lifelong. So we will start treatment, we will plan laser treatment, we will plan medication, and we need to check the eye pressure again. We will be doing some other tests to follow up and check for whether the glaucoma is getting worse or not. So glaucoma is a lifelong disease. Glaucoma needs a progressive, continuous checkup and follow-up. It is not a one-time treatment. So most people do not realize that glaucoma is a lifelong disease and you need to come for frequent and regular follow-up. That is more important than actually starting the treatment.
I have a very important question. Can glaucoma cause blindness?
Unfortunately, glaucoma can cause blindness. And the bigger problem with glaucoma is that once we pick up and diagnose glaucoma, with the earlier and the milder stages, we can stop it from getting worse. But if we pick up somebody with an advanced glaucoma and whatever damage has already occurred is irreversible. The damage is irreversible, and suppose advanced glaucoma is untreated or improperly managed, then it can lead on to blindness. And this blindness due to glaucoma is unfortunately a global problem, and a very large magnitude of the blindness in the world is due to glaucoma.
As a common person, what should I do to prevent or manage glaucoma?
What you should do to manage glaucoma is follow the advice, the medical advice. Suppose we say you have glaucoma, you are suspected to have glaucoma, you should screen your relatives for glaucoma. You should have a checkup and follow up on the date and time you are advised. You may be advised to apply eye drops once or twice a day. You may be applied to undergo laser treatment and come back for a follow up after 3 months. You may be advised to undergo surgery and a checkup after 6 months. So following the medical advice, following the treatment guidelines, following the advice of having your relatives also checked will definitely help in managing your glaucoma and also screening your relatives for glaucoma.
So, by chance, if a patient misses one drop, will it impact? And how can one avoid missing dosages?
Yes, it's a very common problem with all of us as human beings. Suppose you are told to apply drops 2 times a day and come back for a checkup after 3 months, we invariably miss a few drops. That is human nature. We will not be able to 100% apply the drops. We call this poor compliance or missing eye drops. So what we usually suggest is when treatment is suggested, eye drops have to be applied once a day or twice a day or even thrice a day. 2 bottles have to be applied. We generally advise some kind of a reminder which can be set into a schedule. Either we can set a timer or have a mobile app which can remind you, or link it to some day-to-day activity like having breakfast or having dinner, or mark it in a calendar. There are so many methods in which you can ensure that you follow what has been told to you as an advice.
Thank you so much, Doctor, for sharing your valuable insights. I'm sure it will be very beneficial for our audience.